Hi, I'm Sheriff Mike Smith, Utah County Sheriff's Office. Today we're going to talk about our Corrections Division. As you recall, we've been going over our 2020 numbers and the things that we did as a Sheriff's Office. So today our focus is corrections. And honestly, it's a broad area. We have a lot going on in that facility, so to try to keep this condensed, I'll go over a few high points, and again, we'll put out a sheet that goes along with this that talks about more in depth the things we did. As you would guess, a lot of the things that we did in 2020 centered around our response to COVID-19. We had many things going on in the jail that we put in place to ensure that our inmates were safe and were having proper care taken for them. Because of COVID-19, we actually put in place some measures to do what we'll call a partial shutdown. The jail was never shut down, but we did look at who we would take into the jail. We obviously continued to take our severe and our most dangerous cases into the jail, those cases that would pose a threat to the public. But some of our lower level crimes, to keep those numbers down in the jail, we did not accept them in 2020 and provided us room to isolate and to keep the inmates that we had healthy and safe while they were in there. We did a lot of changes to our booking process. Instead of the officers bringing the inmates directly into our facility, the booking process started out in the Sally Port, where every inmate would be tested for COVID-19 prior to entry into the Sheriff's Office, into the booking area. We actually, through grant funding, we were able to purchase and have installed an air purification system that went through our existing AC and heating vents and purified all of the, you name it, viruses, mold, bacteria out of the air in an effort to keep those inmates healthy and safe. One thing that's interesting is throughout the year, we actually performed over 5,000, it was 5,447 COVID tests to inmates coming in and out of the jail. And through that, we had 310 inmates that tested positive. One thing that really affected the way we did work in the jail is our kitchen area. Many people may not be aware that we have a fully functioning kitchen. In fact, it is quite the process in that kitchen, and it's an amazing process if you go in there to see what's going on and those inmates working and doing that work. But one of the things people don't understand is, besides preparing meals for our inmates, our jail also prepares all the meals for the Meals on Wheels programs. So as COVID kicked in and we saw senior centers shut down and seniors staying in their homes and not coming out to get these meals that they were in need of, we saw a drastic increase in the amount of meals that we needed to produce for that program to go out to all these homebound seniors. And while we're juggling that, we're still juggling keeping everybody healthy and safe within our facility. One thing I think most people in this area can relate with is we actually did a storage. We'll call it food storage. So we put together meals to have frozen in case there came a time that because of sickness or whatever, we had to shut down our kitchen. So we had a store of meals, and we still do, ready to go to take care of those problems. We had many things happening in the jail. On top of that, we had our normal jail functions. One big thing was we had our court systems that were not completely shut down, but in some areas they were. And all of our inmates needed to see a judge, all of it moved from in person to on camera, and that was something we had to get set up that wasn't previously functioning at full capacity within our jail. So we had to change interview rooms into now video rooms and get the equipment going in there. So there was a lot of work going into the back end of things to try to keep our processes working. All in all, our jail personnel did a tremendous job. I gotta say, our medical personnel in the jail, we have some very dedicated medical personnel in our jail, did a fabulous job and continue to do so to keep the inmates in our jail healthy and safe. They are getting top end health care that are in there. So again, that's our corrections. There's a lot more going on, and I will release a sheet that goes along with this video that details all the things I've talked about. So thank you, and we'll get to you in our next video.